Hi, I'm Jenna Guerin, and I'm going to be presenting on Hashimoto's thyroiditis. So, this is an autoimmune disorder that can cause hypothyroidism. So, what's happening here is that thyroid tissue is damaged and can't make enough thyroid hormone. And thyroid hormone controls energy usage, so basically the body functions are going to slow down. So, signs and symptoms that we're going to see here are going to be thyromegaly or goiter, trouble tolerating cold, tiredness, weight gain, joint muscle pain, bradycardia, thinning of the hair, and menorrhagia, heavy menstrual bleeding. Um, then the diagnosis that doctors would do for Hashimoto's is going to mainly be based on blood tests. So they're going to test the thyroid function test, which is the TFT. They're also going to test TSH levels. Um, They're going to look for thyroperoxidase antibodies, which are anti-thyroid antibodies, and those are very indicative of Hashimoto's. If they don't find anything really in the blood test, they usually will do an ultrasound on the thyroid, um, and they can kind of get a look at the thyroid from there. So they really don't know the causes of Hashimoto's because it is an autoimmune disorder. It's not really known what the cause is, um, but they have seen a higher risk if it runs in your family. So there could be a genetic factor going on here. And another interesting fact about Hashimoto's is that it affects more women than men, especially when they're pregnant, is when women will really get more signs and symptoms of this. So for treatment, pretty much the main treatment is going to be hormone replacement therapy. They use levothyroxine, which is the hormone that the thyroid produces. So that's going to get that hormone back circulating throughout the body and alleviate symptoms. So the doctors are going to run regular blood tests to make sure that the dosage is correct, and they'll adjust the dose as necessary when they see changes in the blood tests. Another thing that is to note with this is that people with Hashimoto should avoid high iodine foods because it could worsen their symptoms of hypothyroidism. And that's pretty much a brief overview of Hashimoto's thyroiditis.